we are at just a couple of minutes after 3 o'clock, and we've only got 30 minutes together to get to know each other and hopefully learn some exciting things. So we're going to go ahead and get started. So I am Miranda March. I am the project director for the Orange County Resource Directory, which is the project that is hosting this event today. So as many of you know, we are working in partnership with the Orange County Healthcare Association to bring you what we hope are incredibly useful tools and resources, and what I think is a pretty amazing resource directory, where we are housing all of these tools and resources, and also curating and identifying additional resources. Stephen, can you next slide? So thank you for taking the time to join us to learn about school mental health resources. We've been doing these open houses for 6 weeks, and so this is our last and final open house. So folks have been to other open houses that we've held, then welcome back. And to the folks that may be new, then welcome to you. I'm hoping that we will all be friends by the end. So you already met me, and it is also my distinct pleasure to introduce Clara, who is a longtime player in the land of Orange County student mental health. She got her MSW at USC and has been licensed for 30 years. She's worked a lot with the East Whittier City School District, as well as the Garden Grove Unified School District. And in that capacity, she's very much been a leader in student mental health. She helped bring in a multi-year, multi-million-dollar grant to provide prevention and early intervention, and served as the coordinator of Safe Schools and Healthy Students Initiative. I've been working with Clara for about a year now, and I continue to be deeply impressed with her knowledge, with both the scope, the breadth, and the depth of her knowledge. So I'm delighted to welcome Clara, and I'm going to turn it over to Clara since it's time for the headline act.
Wonderful. Thank you, Miranda. Is it showing me up here? I don't know if my screen switched.
Yep, I can see you.
You can see me? Okay, wonderful. Okay, so welcome everyone today. And what we're here to talk about today is really important. So first, I'd like to go over what today's agenda is. And the agenda for today is obviously to welcome you and to make you feel very comfortable that this is a place where you can come and learn, ask your questions, and hopefully find answers for things that you're dealing with at your school during this time of crisis and during this pandemic. Second is just kind of settling in. We're going to do like a quick check-in on just the things that you're struggling with during this time of the year and how to support you. We're going to talk about our 2 featured resources. Miranda had the opportunity to share about all of the resources that we're putting together for Orange County. And so today we're going to share 2 new ones for you. And the last, we're going to hear from you. We're going to do a Menti poll so that we can get your opinions about things, that we can use that information to drive our future workshops, our future products that we create to support schools in the Orange County, and all of Orange County. So anyways, the last thing we'll do is just talk about how we're going to stay connected, because this is an ongoing process, and to have systematic changes, we know it's step by step. And because of that, we want to be here for you to continue this growth, to learn new tools, and to support you as new needs arise. Okay. Next slide. So now that you know who we are, you know who Miranda is, you know who I am, and you know who we are as a group in order to support you, we want to hear who you are. So what I'd like you to do now is I would like you to think about this question. And the question is, who are you? What brings you here today? And what district you're from. So if you could put that in the chat box so that everybody can see it. We have an LMFT, Anna, thank you for being here. Kathleen, This is so wonderful. And these two resources that we created are really resources that can be used across settings, not just in schools, but in outpatient clinics, in your private practice, if you're a private practitioner. We really try to think about how we can meet your needs. And again, we come back to that. So the one thing that I wanted to ask you to think about is just, what does collaboration mean to you in the context of crises? So I want you to kind of imagine a crisis, which probably is not too hard for you if you work in mental health. And I want you to think about, what does collaboration mean to you in the context of crisis? As you think about that, I'd like you to take a moment and just visualize what collaboration would look like for you. Who would be a part of that? Who would be the people? What kind of support systems would be in place? Once you have that idea in your head, I'd like you to be courageous and put your ideas in the chat box so we can begin to talk about that. Yeah, I love this comment from Anna, just resources to get the best care for the student and community partners, right? Because we know no one can do this alone. You have to have those community partners in place. You have to know how to access those partners. And you have to have a good communication system, as Samantha mentioned. And because this is such hard work, I do think it is essential that we support each other and that you work with others and you have people that you can trust to have your back while you're dealing with a situation that involves crisis. And you're right, Mashallah, I love that. Working with multidisciplinary staff, social worker, mental health, community resources, teachers, administrators, everybody is a part of the solution. Okay. I'm going to go ahead and go to our next slide, because I think what you're going to see is that the resources that we're presenting to you today include all of the things that you think are important for collaboration. So let's go to the first resource that we have here on the next slide. Okay, so we have two resources. One is called Help is Hope, and the other one is called the Orange Folder Initiative. So we're going to go ahead and talk about the Orange Folder Initiative first, and then we're going to talk about Help is Hope because it's pretty self-explanatory. I want to take a little more time to talk about the resource. I think you should be able to find it in the chat box. I believe that we're going to put the 4-page initiative in the chat box. And what I'd like you to do is I'd like you to take like a minute or two to open it up and just peek at it. It's pretty dense, so I don't expect anybody to read every line. I just want to kind of have you look at the topics on each page and kind of look at the flow. We have two things that were uploaded right now. One is the Orange Folder Initiative Companion Guide. This really spells out all of what you need to know about the 4 pages of the initiative. And then the PDF above that, if you want to open that, that is the visual of the 4 pages of the Orange Folder. So what I want to do is just kind of give you a quick overview of how this works. You will have the companion instructions. We're not going to go over that because you have that in writing, but I want you to just look up at the first page of the folder, which says speak up for your students. And then it has a message about the staff, a message to the staff. And the most important thing for you to realize right now is that we want to get out the message to everyone that you need to speak up for your student. And this message is particularly to educators in a school setting, but is also for the community at large. And so the main message is, if you see something, you say something. But in order to see something, you've got to know what you're looking for. So there's know the signs of distress. We know that when a student is experiencing multiple stressors, social, emotional, physical, academic stressors, or they've had a recent adverse childhood experience, like a death of a family member, which is becoming unfortunately more common during this pandemic, or something else that's traumatic, that these things together can result in your student feeling like they have no hope. And that stress can result in them having thoughts of harming themselves or harming others. And so we want your staff to fully understand what these indicators are so that they can be alert to them. Students are most commonly at school. So they're more at school than they are at home or in the community. And so teachers and other educators have the unique position to be able to notice these things, especially when there's sudden changes. And the next page is kind of what resources do your school site, what resources do you have in place already? And you may have these, some on a wall, some in a folder, some on Post-it, some on your desk underneath a plastic sheet. But this is designed to have it be in a one-stop shop, so you have it all together. So you can see here to the left on page 2, it says school mental health and wellness. And in this section are some samples of the types of people that we have that do school mental health and the other part of your wellness team. So for example, we've seen that we have an MFT here, we have a nurse here, we have school social workers participating today, we have community members participating, and they all together can be a part of the support team. So you would use this, you would modify this to meet your specific your specific district. Okay. Okay, and so then the next section here is, okay, so you have the people and then you have their responsibilities. And these particular responsibilities vary from school to school. K-6 is going to have a very different team than a high school who might have a school resource officer. So this is where you would modify it and customize it to your school. The next is to the right in the orange section, it says school support and intervention. And these particular parts are also specific to your school. So what does the teacher do if they have a student that comes to them in a crisis and who's written in their journal that they don't have any reason to live? And how would that teacher support the student? So this kind of does a step-by-step of what the school policy is for referring for intervention. The next portion has community resources. So if you look to the left on page 3, you'll see a variety of resources that are specific to Orange County. There are other resources that are listed on our website. And I think it's really helpful if you click on these and see what you have in place at your fingertips so that you can see how they would be helpful for you. The next section is your school district's resources, and this is where you would insert your own. In addition, below that, you would have your community resources. I want to pause for just a second and ask you if you could, from in the chat box, if you could write down any questions you have about this. Now, we may not be able to answer all of your questions, but we do want you to know that we're going to be here to support you. So any questions, just include them in the chat box. We may not be able to answer them now, but we want to know what they are. And then on this next page where it says, does the student need immediate assistance? This is about a decision tree. right? And if it's a crisis and somebody's actively saying they want to kill themselves, then you know you need to get the immediate help from an administrator or a mental health specialist who can help give you that immediate support. The other part is the not sure what to do there, and then know, but still how to help them. And below that is detailed instructions for teachers, educators, and anybody else working in a school about what to say, because I think that's a challenging piece for so many, is what do I say? Okay.
And in case you hadn't seen it, Clara, there is a good question from Erin here in the chat.
Perfect. How does orange folder information get shared with school districts? Is this share through the counselors? Okay, so that's a really brilliant question. This is what we're going to have a follow-up meeting about, and we are going to ask your opinion about this at the end of our session today. Is, we want to know what you think is the best way, because I've actually worked in a variety of schools besides the two where I spent most of my career. And each school that I worked in had a different policy. And what we're trying to do is create a standardization of that policy. But in order to do that, you have to have buy-in from the top. So depending on your school and your school district, we're hoping that you can come up with an implementation plan where it would be presented at the beginning of the year to meet your suicide prevention training requirements that are annual. And that training could be done by the school counselor, or it could be done by a team like a school counselor, school psychologist, school social worker, nurse, principal, school counselor. It really would depend on who your people are. And we would hope that it would be a training that would be done annually, and that it would be fully fleshed out by your district what's going to be on this 4-page folder. How does that sound? Does that seem like I'm kind of answering that question? This page also provides, okay, let's see where, oh, good, wonderful. Okay. Okay, so then the final page I mentioned was the how to talk about it, because as you know, teachers get terrified when students start talking about harming themselves or wishing they weren't around. And we want to make sure that we equip them with the words so that they can feel like they can at least begin the engagement process. And even if they physically have to just walk them to the counselor's office or the school social worker's office or the wellness person's office to get them hooked up for an assessment, that would be how that would work. Let's see, are there any other questions? Okay, so the next slide is the help is hope. So we have the one resource, which is the Orange Folder Initiative. And a part of the whole idea of the Orange Initiative in general is to have all kinds of ways to support students and teachers and other educators. So Help is Hope has already been distributed, but I want to talk about kind of what you can do with this. So it's going to be something that you can download and you will be able to customize it. And it's something that can be put on the back of ID cards. I know many schools have chosen to put those phone numbers on the back of their ID card, or included in their, sometimes it's written on their yearly calendars. You can do it in a lot of different ways, but the important piece of this is that it's a quick resource guide for anybody. Teachers can post it in their room. It can be wherever you want. It's small. It can be given out to students whenever you talk to a student who maybe you sense that they're anxious, but they're not telling you much. You can still give it out then. So there's a lot of ways for distribution. And so this is something that we think can be very helpful. Let's see, is there any, I'm looking for questions. Let's see, chat box. Were there any particular questions about you printed and shipped? Okay, yeah, and Miranda said something that I think is really important. I know education really has limits on the resources, and we want to partner with you to make sure that you have hard copies of things. So there will be future information provided exactly how you can get your updated, customized document to us so that we can then distribute it back to your school district at no cost to you.
Yeah, and we will follow up with everybody who registered for this. And there's a link on our website that allows you to request hard copies to be printed and mailed to you, and we are happy to do that. So we'll follow up with the link after the session.
Wonderful. I think at this point we want to really talk about what it is that would be helpful for us to know more about how to support you. And so we're going to give you an opportunity to share. And I'm going to turn it over to Miranda so she can ask a few questions. And
Sure.
I believe, okay.
Thanks, Clara. So this is
You're
the
welcome.
part where we really want to hear from you. So we've got this this Orange Folder initiative. We've done a really super quick jaunt through some of the functionality of it. And now we want to find out what it is that you need in order to make it useful and relevant to your setting. So we are going to call up the Menti poll that I threatened you with at the beginning. And we'd like you to take a few moments. So open the menti.com in your browser, and we've got a code there. And we're curious to know, how can the Orange Folder support your school mental health initiative? And again, this project is funded through the state, through the county. So we are working for you, and whatever it is that we can do to help you in your student mental health work, that's what we want to do. So again, we really invite you to give us as much feedback as possible. So we had a question in the chat box earlier about well, who does this? Who gets this resource, and how do they then share it out with the rest of the school community? And Clara provided some oversight about some thoughts about how that could be, but we also want to ask you, if we were to give this to you, what would your staff need in order to make it useful? For example, we could do a short video. It's a 5-minute video that walks folks through the features. We could offer a webinar where we went through it in more detail. We could do a community of practice where we had folks from different regions who are either in the same role or different roles come together and really work through and problem solve how this resource could be used. So all kinds of ideas off the top of my head, and we will probably do some of those things, and we might as well do the things that are going to be the best use for you. There could absolutely be quarterly meetings between the districts, and we are, in fact, a technical assistance and training agency, so we have lots of capacity to provide training and webinars, and perhaps at some point we could even do such things in person, knock wood. Okay, so these are great ideas. And of course, whenever you ask a bunch of people a question, you get a bunch of different answers. But the good news is that we can actually do all of these things. If there's interest, then we can provide additional implementation training, and that is in fact what the next question is if we were to provide a webinar or a quarterly meeting or a video, is this something that you think could be useful for your staff? Oh, I like that one just popped up. Even though it's only one person, it's still way higher than the no, which as far as I'm concerned is a good thing. All right. I just want to reiterate that, all of these, both the orange folder and the orange cards can be requested by your school or your district. The orange cards are going to be available in 6 languages, so we can also ship them to you written in multiple languages. And we will follow up after this session ends with a website link so that you can go ahead and request those if you want to.